It's my pleasure to invite Roberto Leon here. He is a attending assistant professor up in Mayo Clinic, Rochester. He's coming from Ecuador originally. Did his residency and chief residency at University of Iowa, then went to Mayo Clinic in Rochester and was the chief fellow there. And I like him so much that he has stayed there, and he's been a great addition to our breast team. He'll be speaking about what's new in HER2-positive breast cancer.
Well, thank you, Alvaro, and thank you to the conference organizers for inviting me. As he said, I'm from Ecuador, so I was so excited to come from Minnesota to Florida that I packed my sunglasses as the first thing that made it to my suitcase, and I forgot my actual reading glasses. So I hope I can read my slides here. So I'm going to be giving a brief update on HER2-positive breast cancer, and as many of you who attended ASCO and San Antonio, a lot of the focus has been on ER-positive disease and some exciting developments in triple-negative with a few studies that have potential for impacting practice or at least reaffirming practice in HER2-positive disease. So I have no financial disclosure, but I will be briefly mentioning at the end some of the novel agents that are in development for HER2-positive disease. A brief outline. So I'm going to spend a little time at the beginning discussing the focused update of the HER2 guidelines by ASCO and CAP, who have changed again. The guidelines of testing for HER2 positivity. I'll briefly spend some time talking about the NSAB-PB47, which does not impact our current practice, but if anything, clears a question that had been present about HER2-low positive breast cancers patients, HER2-low breast cancer patients. And then I'm going to be talking about treatment de-escalation studies. So the previous year, it was all about treatment escalation. We saw the data from Affinity. We saw data from the Extenet trial of the addition of neratinib. Now the pendulum is swinging to those studies that are evaluating treatment de-escalation. So I want to focus a little bit on APT and an update on those results, even though that's from the preceding year. I think it's important to put those results into the context of the next two studies, SOLT and Persephone. And then, as I mentioned, we'll discuss a little bit about the novel agents in development for metastatic HER2-positive breast cancer. So I'm not a pathologist, but every time I look at this flow sheets or algorithms, I get a little lightheaded. We have a lot of confusion, I would say, when the 2013 HER2 testing guidelines were released. So just to refresh everybody's memories, if you start out, so this is focusing exclusively on the dual probe FISH testing of